Hey, Dr. Erickson here. Hey, here's a scenario. You're exhausted and you always feel like you're playing catch up. You feel like you could sleep for a month, and yet when you do sleep, you don't feel rested. Your hair is falling out. The outer third of your eyebrow may be beginning to disappear. Your hair is changing texture. You've gained some weight around the midsection or even throughout the whole body, and you'll be darned if you can do anything to get rid of that. Seems like no matter what you do, nothing seems to work. You may be beginning to feel depressed and low. So you think, you know what, maybe I've got a thyroid problem. So you head on over to your primary care and they run some labs on you and they say one of two things. First off, maybe, you know what, everything's fine, your labs are normal. Maybe it's in your head. That's just a joke there. Or they may say that you have a thyroid problem and they put you on some medications. Did you know there are actually 7 different pathways that can cause a thyroid problem, and only one of those can actually successfully even be treated with medication? And even then, 17% is the best success that you're going to get with the medical route. Okay? So the typical test that's ordered for thyroid problems is typically what's called a TSH, maybe a T4. Unfortunately, those 2 markers alone, which that's typically what your traditional labs are going to run, those 2 markers alone are not enough information for you to be able to identify, are you one of the 7? Okay? So if you're not getting properly evaluated, you're not going to be put in the proper category. You're not going to be treated appropriately. Now, if you're on HRT, hormone replacement therapy, Thyroid or something like that, and you are not getting results with that medication, there's a very, 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 very strong possibility that your problem is not that pathway. There is another, one of the other 7 or 6 pathways is what you need to be looking at and dealing with. It doesn't make sense to treat everybody the same way. With the thyroid, it's very complex. It's not just the thyroid. There's other parts of the brain and other parts of the body that are actually involved in proper thyroid function. And if you don't understand and realize the involvement of all of those things, you're going to be shooting in the dark as far as you're trying to getting yourself some results for your thyroid problem. I can help you sort through that thyroid jungle. Come to one of my workshops. Be happy to talk to you about those different pathways. We actually go through them, each one of them at our pathway. Bring your lab work with you as well. If you have any other questions, poke around on our website here. Call our office. We do have clients who come in directly and get evaluated for that. You do need to realize, though, that getting at the cause is what this is all about. Treating your symptoms, never a good idea. You find that the symptoms are never going to completely go away, and those symptoms, if they do go away, seem to morph into other symptoms and more problems. It's Dr. Erickson saying, hope you find the answers you're looking for. Give us a call if you feel like there's anything we can do. Have a great day.